Welcome to this LEX 18 Digital Conversation. I'm Dia Davidson. White House clinics are all across central Kentucky, from Richmond to McKee and Paint Lick. Joining us to talk about women's health issues is CEO Stephanie Courtright-Moore. Welcome.
Good afternoon. Thank you.
Let's talk about it, because as women, we have unique health issues and questions, and sometimes it's hard to try to find someone besides your best girlfriend or your mom to talk to.
Absolutely. I think we're so busy juggling so many things in life that we often forget to take time for ourselves.
Right. So if I'm out there and I'm sort of burning that candle at both ends, why would I select White House clinics?
I think one of the things we try to do at White House clinics is to make that patient experience as convenient as possible. We know that oftentimes we're trying to fit 90 minutes worth of stuff into a 30-minute time space. So we want to be sensitive to that and try to make that patient experience an efficient use of your time. We offer multiple disciplines of care, medicine, dentistry, pharmacy, behavioral health, all working together to address your needs.
All under one roof, or are they at various satellite offices?
Most all of our locations have all of those services under one roof, which makes it hugely convenient.
So one-stop shopping, huh?
Absolutely.
You know, how long has White House clinics been around?
We were started in the early 70s, so we're approaching 45 years.
Wow, so this is sort of an unknown, untapped resource and jewel, huh?
It is, absolutely.
All right. All right, let's talk a little bit about the services that you offer. It seems to me that healthcare is so expensive these days, and you know it's a choice sometimes for some families whether to get care or to not get care. How can you help a family who's facing maybe that type of decision?
Well, one of the things that we're proud to be able to provide is a sliding fee scale. So if a family doesn't have insurance, they can bring in some real basic financial information, and we put them on a sliding fee according to what they are able to pay in their family.
Oh, wow. And this is for all of the services that you offer?
Absolutely, yes.
Okay. Well, now, if I'm scheduling, how do I go about scheduling an appointment with a doctor at White House? And would I see the same physician each and every visit, or are they, you know, transient physicians, and so it's just whoever I schedule that particular day?
Most often you can see one physician, and we really encourage patients to try to establish that personal connection with one care provider so that you can develop that history with one another, you can develop that comfort level. However, one of the things that we do offer are extended hours. So perhaps you need to come in on a Tuesday night and your provider doesn't work late that day. He or she, you know, shares a medical record with all of the healthcare providers within our organization, so they're still going to have a really comprehensive look of really what your healthcare issues are.
Well, specifically, we were going to talk about women's health.
Yes.
And the importance, you were saying, of establishing relationships, because a lot of times these are very personal, very sensitive issues. How do you suggest a patient go about selecting a physician? What are some of the things that you would suggest to them to sort of look for? Is it where they're from, or where they went to school, or their specialization, or how can you help a person who's looking at this say, this is how I can establish or find the right doctor fit for me?
Choosing a healthcare provider is certainly a really individual decision, so I encourage patients to think about, you know, what matters to them most. Oftentimes, patients might be more comfortable with a provider who shares similarity even in terms of faith. You know, maybe their spiritual beliefs are really important to healthcare decisions, and we want to be sensitive to that as well.
Sure.
But I really encourage people to sit down and think about what's going to drive my healthcare decision most. Is it important to me if somebody went to the best medical school? Or is it more important to me that I can connect with that person and have a relationship? For me personally, being able to be comfortable and feel like that person isn't judging me, that I can tell them whatever crazy thought is in my head at a particular time, and that I'm not going to be judged. You know, that's something that I find personally important.
Sure. So let's talk about some of the services that you offer for women. We know that breast health is very, very important, as well as heart health. So the symptoms are not the same for women for heart and heart attack. So do you offer any screenings or physicians who specialize in cardiac care?
All of the providers who work for White House Clinic are family providers, so more generally trained providers, well trained to kind of pick up on those nuances. So even, oftentimes, even the process of taking our vitals at the beginning of a visit, as a patient to us, that's kind of a routine, endeavor. But to a well-trained provider, the nuances that they see over time, they start to see our blood pressure creeping up, or they maybe start to see changes in our weight. Those are triggers to them and signs to them to ask further questions to help us assess our health risk.
What about blood labs? Do you provide those there too, or would we have to go to a hospital or some other outside facility?
No, we can draw the labs in the office. So, our goal is really to minimize the amount of stops that a patient has to take after they leave our office.
What about breast imaging and mammography? Do you offer that?
No, we rely on community partners to do the mammography screening.
All right. Now, colorectal cancer has been a big one too. Do you offer colonoscopy, endoscopy, or do you also partner with others?
To do the colonoscopy, we partner with other specialists. However, there's also another test that you can do at home in order to screen for colon cancer. So we can provide that card to the patient. They can go home and then drop it in the mail to us, and we can screen for colon cancer that way as well.
Yeah, because for a lot of people, that's not necessarily the most fun
it's
thing
not
to
the
do.
most fun. And this screening is an annual screening as opposed to colonoscopy being a 10-year screening. So you do have to do it a little more often, but there's no diet changes or any preparatory.
And you can do it in the privacy of your own bathroom.
You can.
Yeah, exactly. And that's important for a lot of people. Diabetes is big in our state too. Do you offer nutrition counseling? Anything that's case specific to diabetes treatment?
Absolutely. One of the beautiful things about our organization is we really are in a position to add members to the care team to help support the needs of our patients. And in early 2017, one of the things that we saw was that patients really didn't take as much time as maybe we should to educate ourselves about different diseases. It's one of those things, you're leaving the office, they give you some paper you're supposed to read or a video to watch.
And it gets put under.
Yeah. You use it to write your grocery list on the back. But we added community healthcare workers to our care team, and they're in the office. So after your visit with a physician or nurse practitioner, they can spend an extra 15 minutes with our patients walking through, here are the things that you should know about your disease. Here are the actions that are really important for you to take, and help you start to set some small goals, because we know that, having to lose 20 or 30 pounds can be overwhelming, but if we can start and establish some small victories, we can gain some momentum in controlling those diseases.
Now, typically, as women, and when we have families, we put everybody else's health before our own. So that's why I want to talk about women's health first. But as an outgrowth, we care for and look after our children. Offer pediatric care as well?
We do. We have an active pediatric program. We're taking care of patients from birth to death, basically. Geriatrics, adults, pediatric patients as well.
And men are thrown in there too?
We'll take care of a few.
They go kicking and screaming into a doctor's appointment. So there are physicians who specialize in men's issues as well.
Absolutely, right? Absolutely. And that's, we really are able, with the extended hours, with the Saturday clinic, to work around really anyone's schedule. So oftentimes we'll have husbands or male patients who work out of town earlier in the week, and so that those Saturday hours are really convenient for them.
Let's talk about mental health. It's one of those subjects that people don't like to talk about. They want to shy away from those issues. But it's become more and more of an issue as we see it related to children and to just the general populace. Talk a little bit about psychiatrists or psychologists that you may have and what they specialize in.
We have one psychiatrist who actually lives in Louisville, and we use telemedicine technology to offer his services. So, if you're a patient who's, per se, in Jackson County, you don't have to leave McKee in order to have the services of a highly trained specialist.
Oh, wow.
And then we supplement that medication management piece that the psychiatrist does with licensed clinical social workers who are therapists, who patients might see more frequently to do what's oftentimes the more difficult work of addressing a mental health issue.
Indeed. Now, let's talk about telemedicine. That's very new. So are we Skyping from home, or are we coming to the facility? What are we doing?
Currently, our patients are coming to one of our 9 locations,
Okay.
and then we're doing the connection. However, I think, we hope as healthcare professionals that we start to use Skype and some of those additional technologies to make it even more convenient for us to connect with our healthcare providers.
Indeed. And also, I guess, if you have individuals who are homebound, do you offer any outreach for them, or is that still sort of on the horizon for you?
We do. We have a couple of providers who do home visits on a regular basis.
Oh, wow. And how would you call to set up something like that?
Those patients need to have been established with our organization at some point.
Okay.
So at least once we would need them to come into the office. It's important that we have some of the tools and technology that we have in the clinics to make some initial diagnoses. But then after that, we're able to do those home visits on a routine basis.
Wow, this has been so very interesting because it's very different than, just the typical going to the doctor's office kind of thing that we've all grown up with. What hospitals are you affiliated with so that if someone needed bigger care or hospitalization that they would be affiliated, and would those physicians have hospital privileges with those hospitals?
We partner with all of the hospitals in our community. So if I'm in Irvin, we're going to call our colleagues at Markham Wallace. If I'm in Mount Vernon, we're going to call our colleagues at Rockcastle Regional. In Richmond and Berea, we call either the St. Joe system or the Baptist system. Okay. Our hospitals, along with several other community agencies, really are great partners in taking care of our patients. So what happens if somebody does need an admission is we call the facility and we talk to the hospitalist. Most times at this point in this modern era, hospitalists manage the inpatient care rather than the clinic provider. That's just so that somebody's there most all of the time, really specializing in that hospital medicine.
Okay, wonderful. Thank you so much for stopping
by. I appreciate it.
And of course, always thank you guys for watching this LEX18 Digital Conversation. Be sure to watch more conversations on lex18.com and check out White House Clinics online. Until next time, I'm Dia Davidson.